Hello everybody, it's Sarah Larcher from 9 a.m. Bio Lecture, here to try and do this project, so here we go. Let's look at the guidelines here. Gotta keep them pulled up, you know. Alright, so first, my COVID data spreadsheet. Well, here is the raw data here. We got for Lawrence and Custer County, and I have new cases, total tests, the positivity decimal, and then the positivity rate, and the date over here. Same thing here for Custer County, new cases, total test, positivity decimal, and positivity rate. I chose these counties because I live in Lawrence County right now, but I'm from Custer County, so I do go home to visit a lot, a fair amount. Alrighty here, and I have information, data from the beginning of the project, and I've done it all the way up through today, 10/29. So yeah, the data for Custer County is a little bit weird at points. The numbers just don't match up, but like Dr. Metler said, we just report what we're given. So like right here, saying that there were 2 cases but no tests obviously doesn't match up, so my spreadsheet is freaking out. Same thing up here, but there isn't really anything I can do about that. So yeah, positivity rate has been pretty high in both counties as we've been going along here. I used the benchmark data for my project because I liked it. It was the easiest for me to read, and I just went to county statistics here and clicked on the right county and everything and just did that. And it was also easy because you can catch up. So like I would just click on Lawrence County and go through and be like, all right, here are the cases for this, because life, and I got behind on it. So that is my raw data. The areas and population size, let's have a look. Custer County, my hometown, has actually grown in population size, if you'll believe it, and has a population of 8,726, according to 2018 data here. So that's actually really big because we used to be a lot smaller than that. And then Lawrence County has a population of 25,741. So Lawrence County is like about 3 times bigger than Custer County here. But I think that could affect my project because if the population is smaller but the positivity rate is still at 50%, there's like a different amount of people being affected. It's pretty bad if the positivity rate in Custer County is at 50%. I guess because it's like population spread. So I guess with the positivity rate, like the population spread is still going to be kind of the same, but in like Lawrence County, there's more people to infect. So I think that influences the results. Let's go look at my line graph that I made. Let's see here. So here's my line graph, and I brought it up in size a little bit so that you could see it better. The blue line is the Lawrence County positivity rate, and the orange line is the Custer County positivity rate. Like I said, the Custer County data was really weird from benchmarks, so there are times where the positivity rate, like right here, went to 400%. Like on the 24th here, no, the positivity rate wasn't actually at 400%. That's just the numbers being wacko. The Lawrence County positivity rate must have gotten a little wacko some points too, because it's dropping below 0% right here, and that doesn't really make sense. It shouldn't be, but it did. And then, yeah, but the Custer County positivity rate went above 100% a lot. Lawrence County only went up a little bit above 100% a couple times, and down below 0%. But what we're seeing here is that a lot of the time, Custer County positivity rate was very high at the beginning of September, and then it dropped towards the end of September, beginning of October, and it went up again, and it's dropping again. So it's like kind of lying at about 50% right now, but not as high as it was in the beginning of September. With the Lawrence County, it looked like it was high in August here, and then high in September, but really dropped towards the middle of September and had like a couple spikes like right here at the beginning of October, but it was staying pretty low. But now you can see it starting to rise towards the end of October as our cases increase. So yeah, pretty interesting stuff right there. So I don't know what would happen if we tried to remove it. I guess we could always try to remove, let's see, if we just took this out, does it change the data? Interesting. Okay. Looking for other times when, yep, it changed it a little there. Let's see. All right. Removed a couple of those outliers there. And let's see here. And it is not updating my graph. I don't know why my Excel is being dumb. But okay, just going from my idea of what would happen, since it's not updating my graph, if we took those out, I think that this huge spike that brought it up to 400% would go away, because obviously it didn't happen. So yes, if we took the outliers out, it would affect it, and I am sorry that my Excel isn't updating my graph, which is weird because it was working fine before, but things happen, and it's Microsoft, so. Alrighty, and let's look at the article. I was kind of viewing this article before I did my video. I was looking at it last night, and I know that our state is not doing enough. Here we go. To enough COVID testing, and I know that our country isn't either. It does vary from region to region because, as you can see here, 9 states meet the testing target. So those states like Maine, yes, they're doing really good. They're meeting the testing target. And then some states are near it, but 37 states, most of the states, well over half aren't meeting testing targets. So obviously our country isn't meeting testing targets for COVID-19. And I think that information affects my project because we are trying to report positivity rate, but we don't know the actual positivity rate if our country is not doing enough testing. And if our state isn't doing enough testing, then we don't know how many people are actually positive because we're not doing enough testing. So this is just our estimate from the information that we have. But obviously we need to do more testing, go out there and gather more information, and then our positivity rates would be closer to what is actually true of the spread out there. How would the information influence public healthcare versus professional versus government? That's an interesting question. The general public is not very scientific. We would just panic, like, unless we actually sit down like I've been able to do thanks to this class and like look at the information, we won't we'll panic. Healthcare professionals, they're probably used to this and they're probably pushing for more testing, saying we need more. And government officials are more about money So they're probably like, yeah, maybe we should have more testing, but I can't fund that. So government officials are probably just like stressing because they can't fund more testing, and healthcare professionals are fighting for more testing, and I think the general public is really ignorant of what's going on. No offense to the general public. Um, yeah, so I think that that covers everything. I'm really sorry I couldn't get the outliers out of my graph, but I think, we all get the idea still. If we were able to remove those from the graph, then this would obviously go down. So, yep, that's all I gotta say about um, COVID and my little graph here, and I'm probably gonna keep this up till the end of the semester, keep abreast of the knowledge. Thank you.